Hi, Jenny from America. I'm not going to give it your all. I am deeply disturbed with what I just read. Before I give you the information that I read, I want to explain to you how America does the death penalty here in states when they use lethal injection. Okay, there are a lot of people that are against the death penalty because they believe it is cruel and unusual punishment. They use 3 drugs. First drug is an anesthetic. It could be propofol or sodium pentothal, something like that. You want to put them out, okay? Problem is, that's not a guarantee that that happens, all right? And there have been instances where people that are against the death penalty believe that the person that is being lethally injected is not sedated. Second medication is a paralyzing agent. Usually it's something called pancuronium, something of that effect, or a cousin to that. What that is, blocks all the muscles. You're completely paralyzed. First thing you can't do is you cannot breathe. You cannot use your diaphragm to breathe. If you are awake during this whole thing and that anesthetic did not adequately put you out, it's like you can't breathe or do anything. You are completely paralyzed. And there are instances, and we have read this, where people that are currently having surgery at the time believe that they wake up, they don't open their eyes. What they do is they become conscious. They were given a paralytic agent in order to be intubated, so you can paralyze those vocal cords, completely paralyze those muscles so that surgeon can get in deep into you. And they had this feeling, I can't speak. And that is what's scarier. So then the third medication is potassium. Large amount of potassiums will stop your heart like that. And that's what killed you. Now, another reason they give you that paralyzing agent in the death penalty is because the dying process is horrible. You have people witnessing this. It is not so much for the person that is being lethally injected, although it does stop, you can't breathe. It is more for the people that are witnessing it. So as you are dying, it's just horrible. You don't want those people to see this. Okay. Now, again, pancuronium, which I thought was a short-acting agent, someone in the comments corrected me and said it's a long-acting, okay? That's even scarier. Now, there's another medication that's kind of like this that they often use in anesthesia called succinylcholine. Another name for this is, and I'm going to have to spell this because I can't pronunciate it, is SUXAMETHONIUM. Okay? Now, I have noticed several instances, and so has Michael McConville, where in order to intubate these babies, they're giving them pancuronium or a cousin to that. It's scarier than shit medicine that should only be ordered by or given by a doctor that's extremely skilled, critical care physician, critical care trained A&E doctor. Neonatologist would be considered a critical care doctor, or an anesthetist, or what we would call an anesthesiologist, or a nurse anesthetist in the America. There are some instances, if you are a critical care nurse and that doctor is standing right there at the bedside and you need to rapidly intubate them, they may say to that nurse, give them pancuronium, succinylcholine, or that medication. That would be fine because that physician is right there taking responsibility and intubate them. We know from Shuli's panel that these doctors did not know how to intubate, okay? These trainees and the consultants, they put wrong tubes in. There were multiple attempts on that, okay? Again, yes, these babies prior to intubation were given morphine. I I am not, as a nurse. Now, granted, I am not an expert in this, but as a nurse chart auditor, I would be going, oh shit, is this enough morphine to put them completely out so they don't realize what is going on, that they are about to be completely paralyzed? Probably the most scariest thing you can imagine, that feeling, just laying there and you're absolutely paralyzed and you cannot breathe. Now, what I just found is, as I'm going further and further along in these medical records, a child by the name of Child Q. Of course, Lucy was found, I believe, not guilty, or was not, or what, either it was a not guilty for the Child Q, or it was not a verdict. It doesn't matter. This poor baby suffered. What happens is I'm looking at this, is that was Dr. A or Dr. U. I think U in Thurwall, A in the trial. That was the so-called boyfriend. It wasn't a boyfriend, but that was the one who, let's just say, tried to get his you-know-what on Lucy and took advantage of her, as she was very, very, already, he had met, by the time he met her, she was already traumatized with all these deaths, and he was trying to lay the one on her so he could have a you-know-what as a married man. He and Child Q used succinylcholine to intubate that baby. I am not confident that he gave that baby enough morphine before he gave that succinylcholine. I am concerned that that baby suffered. Just as anyone who is against the death penalty, and I will not tell you what my feelings are, I'm just telling you what the people who are against the death penalty say. Giving them that paralytic medicine, unless you are absolutely, positively, 200% sure that that person is completely out of it, is cruel and unusual punishment. Now, what do we know also about Dr. A, Dr. U? We do not have the actual medical records as I was able to get to in Thurwall for baby O, okay? What we know about him, what he did was, Lucy called him. He was the registrar. Come, something's wrong with baby O. We know from Shu Lee that baby was not only from Shu Lee, but Richard Taylor. That was the neonatologist that was at the December press conference. We know that baby was intubated, placed on a ventilator setting that was absolutely inappropriately. It blew its stomach up. It was too high. So we now know that man didn't know what he was doing to intubate, okay? He didn't know his ventilator setting. He was, I believe, a 4th year, please let me know if I'm wrong, a 4th year trainee as a registrar, and within weeks or months of becoming an actual pediatric consultant. All right? He didn't know his vents. He should that's a 1st year trainee. That's not a 4th year. And he testified against Lucy. Not only did he then place this baby intubated, place it on high ventilator, and then walked right out. You have to listen to Michael McConville to believe it. Michael McConville is absolutely apoplectic that he left that intensive care unit. Michael McConville said, I wouldn't have left the unit. Right, you don't do that. You don't leave that unit, that ICU. Now, I do not know if that baby was given succinylcholine, all right? I do know he gave it to Q, but I suspect if that's what he did for Q, that was probably the protocol he used. So that, okay, so what am I theorizing? Do I have proof? Absolutely not. I am theorizing as a nurse with a 40-year experience, and also one with a chart auditing experience in the neonatal unit. I suspect that baby may not, although probably got morphine, I do not know. And in my heart, I pray that it got enough morphine. We don't know. If he doesn't know his ventilator, he sure as hell probably doesn't know the correct morphine dose to give it. It's not so much morphine to relieve pain. It's to knock you totally out. Did he give that baby succinylcholine too afterwards to completely paralyze? So that not only did that baby be stabbed, when we know what Brewery did with that needle and stabbed it, okay, it bled to death. But did it suffer even before that with a paralytic agent? Was it aware, even mildly aware, that it was being paralyzed? I do not know. But I do know that Dr. A tried to get himself into Lucy's pants. And don't tell me he didn't. I, as a woman, I read those texts. I saw what he was doing, what he was saying to her. He was coming on. He was trying to get on to her as a married man of, well, I believe those kids were either teenagers or close to teenagers. What a scumbag. What an absolute scumbag. And then to demand anonymity and then to testify against her at the trial. And then Judith Moritz and Liz Hull had the balls to say, oh, how dare Lucy cry when she saw him. What a couple of bitches. I want you two women to realize that that baby could have suffered horribly, horribly with a paralytic agent and felt itself suffocating to death. The same, like a second or third cousin to the agent, that people are that are against the death penalty here in America say should not be used as part of the cocktail. That baby could have been paralyzed. I don't know, I pray to God it was given enough morphine that when that needle came in, it couldn't even fight. It just laid there, just like a patient does when they don't put it in enough anesthesia. Although the patient gets that paralytic agent, but not enough anesthesia, can feel themselves having surgery. Now, if I am wrong, I will apologize. All right? I want anyone here that has any kind of a medical knowledge or anything to please leave a comment. I want you to Datex me. I pray to God that I am wrong. I pray to God. And I know I am not supposed to enter emotions into this, but damn it. These babies suffered. They suffered. And I am so sorry if you're a parent watching this that had a baby that I pray to God that somehow that you're able to find some sort of solace in this. I know you can't. And I'm so sorry if you see this. I hope there's someone there to give it to you. And Paul Hughes, Judge Goss, Nick Johnson, Dewey Evans, Dr. A, Brewery, all you consultants. What the hell were you doing in that neonatal intensive care unit? That was an absolute church of horrors, house of horrors, filled with filth that you knew. What were you doing? I can't wrap my head around this enough. Goodbye. I'm going to go. I'm going to go pet the Empress. I have read some things as a nurse, but nothing is more disgusting than this, to think that those babies went through. Bye-bye.